nightmares in my head. I fear that the thoughts
Hello
build up
everyone.
until
Today we're going to talk about gambling, genetics, and parenting. I decided to make this video after I read about gambling problems among teenagers. Did you know that 60 to 80% of high schoolers in the United States engage in gambling with money at least once per year, and that 3 to 7% of teenagers are addicted to gambling, and most of them do so without their parents knowing about it? If you would like to know more, check out the link that I have in the description below. Gambling addiction, like other addictions, tend to run in families. You're here, perhaps you would like to know more about the genetics behind it and to find out if there's a genetic test for it. Hello, welcome to Dr. XY's channel. I am a board-certified clinical laboratory geneticist, and here I go over all things fascinating about genetics. Today's content is partly genetics, partly exploration by a parent. Gambling behavior is as old as the human race and is universal. Although most people can engage in gambling without much negative consequences in their lives, some people develop gambling addiction, and that's what we call pathologic gambling. Pathologic gambling occurs in about 1% of the general population. The prevalence, however, becomes 20% when we look at first-degree relatives of pathologic gamblers. In addition, people who perceived their parents as gamblers are 3 times more likely to become gamblers themselves compared to those who did not. You might ask, just because it runs in families, does that mean it's genetic? And this is a very reasonable question because families not only share genetics but also share environment. Other studies, particularly those done on twins, showed that genetics indeed can influence one's tendency to develop this addiction. Environment, it can influence that as well. So which one is more important, and how do the two balance each other out? And how they contribute to this development of addiction is influenced by multiple factors, and we'll go over 2 of them today. The first one is gender. Males are more likely to be influenced by their genes rather than the environment when it comes to gambling addiction, while females are more likely to be influenced by their social environment. The explanation to that is that men tend to be less social than women, so they're more likely to be isolated, faced with their genetics on their own. Women are not only more social, but we socialize with many activities that are not gambling. So in a way, male gender becomes a risk factor for the development of gambling addiction. The next factor is age. Adults are more likely to be influenced by their genetics, while teenagers are more likely to be influenced by their social environment when it comes to gambling addiction. And if we think about it, adults have more tendency to be on their own, again, faced along with their genes. Teenagers are still living with their parents, and at school, they're surrounded by their friends. At the same time, gaming is an important way for teenagers to socialize. So some of them may get involved in gambling via these games without even knowing about it. If we put the 2 factors, gender and age, together, we can see that if we isolate or minimize social environment from a person, that person's genetic risk factor can really take off. And if this person is exposed to bad social environment, of course, that makes things worse. But positive social environment is a powerful antidote for behavioral addiction. At this point, you might ask, aren't you a geneticist? When are you going to tell me which test I can run? Well, we have studied many genes, especially those that are involved in reward-seeking neurological pathways. There are genes that are important. There are SNPs that might influence it, but there's not a single test one can run to say these few genes that we test, these few SNPs that we look at, these are the ones that switch the tendency of gambling addiction on or off. It doesn't exist. And in fact, I would caution that if someone claims they can do that, we should really be suspicious, especially they are going to also sell a bunch of products in addition to the test. So how can we find out? And is there a way to find out one's tendency to develop gambling addiction? The answer is certainly yes. And the gambling industry has known that for decades. In fact, even before the rise of internet, casinos tracked customer behavior to identify high potential customers. These are the ones that tend to develop addiction. Casinos would target them and keep them coming back. These days, it's even easier to do that because people are online all the time, especially teenagers. So the gambling industry has many creative ways to coax them and keep them hooked. So what can parents do? I would argue that if business can track customer behavior to make money, parents can do similar things to counteract that. Perhaps we can sit down and ask our children what they would like to do throughout the day and what they would like to learn. And then we intentionally observe them. To really understand them, we not only notice what they accomplish and complete, but also what they have skipped and what they're struggling with. What makes them tick? Are they constantly seeking challenges and thrills? If so, perhaps we can encourage them to develop hobbies that can fulfill those desires and help them make friends at the same time. For older children and teenagers, just beware that online games can sometimes involve gambling. We can teach them skills to identify that, or we can just play the game with them. It's okay if we're not that good. And if you are worried because you see signs of gambling addiction in your child, please seek professional help and social support. Remember, positive social environment is a powerful antidote for behavioral addiction. In summary, although genetics can increase one's tendency to develop gambling addiction, social environment is important as well. By intentionally observe our children, we can find out their passion, their anxieties, their strengths and weaknesses, and we can use these knowledge to guide them to observe themselves and empower themselves. So I'm going to wrap up now. If you think today's content might help someone you know, please forward it. And remember, if you are worried about your child, please seek professional help and do not fight this alone. Thank you so much for visiting. I will see you next time.